Welcome back to the show of Development Dialogue. আমরা এতক্ষণ আলাপ করছিলাম আমাদের অক্সফামের কলিগ ক্যারির সাথে এবং মুসলিম চ্যারিটির ওয়াক্কাসের সাথে কথা বলছিলাম। আমরা একটু পরে আলোচনা করব অ্যাবাউট ম্যাটারনাল ডেথের সিচুয়েশন নিয়ে। আমরা ছোট একটা ডকুমেন্টারি দেখে নিব। এই ডকুমেন্টারিটা মালাউইকে নিয়ে, মালাউইতে ম্যাটারনাল সিচুয়েশনটা কি অবস্থা পজিশনে আছে, এরপরে আমরা আবার আলোচনা করব। তো আমরা একটা ছোট্ট ডকুমেন্টারিতে এখন ফিরে যাচ্ছি। ডকুমেন্টারি আমরা দেখব, এরপরে আলাপ হবে ইনশাআল্লাহ আবার। আচ্ছা, ডকুমেন্টারিটা বোধহয় এখন রেডি হচ্ছে। আমাকে মানে কন্ট্রোলটি জানাচ্ছে আর কিছুক্ষণ বাকি আছে। তো আমি যেটা আলোচনা করতে যাচ্ছিলাম অ্যাবাউট মালাউই। Malawi is a country where there is a huge maternal mortality rates, and understand Muslim Charity has initiated some work. Can you talk about it?
Inshallah, yes. Muslim Charities looked at the situation in Malawi, and inshallah the aim is that we will be establishing a facility of at least 25 beds to provide maternal care. A facility where qualified people, medical personnel can arrange for mothers to give birth. The project is already underway. The site's been acquired, and inshallah ta'ala the construction of it will begin soon. The campaign is being prepared as we speak, and inshallah the aim is over the next year or 2 years we will be able to really start a facility that will benefit, as you will see later on in the program through the documentary, that there is a dire need, and you will see the situation that that is at this moment in time on the ground, and it is really this dire situation that the hospital, the maternal hospital, will look at tackling. And one of the key factors here is to improve access to the public by taking small facilities as close to the rural population centres as we can, because a lot of the time, as Kerry mentioned earlier on, that we don't think of it this way, but people in those countries, in Malawi, have to walk miles and miles when they are pregnant to be able to make deliveries. And it's a very sad situation when you think of it, because it's a very, very vulnerable position that a lady is in at that time. In fact, I remember Muslim Charities' incentive or primary reason for starting this was that some of the organization's early members, the chairman and stuff, they came into contact with a lady who had suffered a miscarriage because she was traveling on a motorbike, and for miles and miles, and because of the nature of the travel, it just couldn't get there on time, and it was a miscarriage and stuff. So it's incentives like these, reasons like these, why Muslim Charity engaged with it in other countries like Pakistan, and inshallah will develop the program further into Malawi over the next year or so, and thereon into Bangladesh, inshallah. Yes.
I think very interesting is the Muslim Charity is relatively smaller charity. Compared to other large Muslim charities, and this founder is a big Islamic scholar, Muslim scholar, and holy man, Sheikh Imdad Pirzada. They concentrate approximately, I understand if I'm not wrong, half of their revenue on maternal health. They began on this. I don't know how they found out that was the need. So their main emphasis in Pakistan, they've got 5 maternal hospitals, big scale activities they're carrying out, and now they're going to Malawi, and I understand you are doing something in Somalia as well.
Yeah, we've considered plans.
It's very unusual, and I think this is if the other Muslim charities behave that way, then we would not have this program today. But nevertheless, well done Muslim Charity for that. Kerry, can you tell us about Bangladesh, because I understand Oxfam has got a huge presence in Bangladesh.
Yes.
With regard to what the situation on maternal health in Bangladesh.
Yeah, Oxfam has been working in Bangladesh since the early 1970s. Not so much on health, more around sort of livelihoods, fair trade, and some of the flood risk reduction work as well. But on health, Bangladesh has made significant progress, and it really is on track to achieve the Millennium Development Goals you mentioned earlier. And just an interesting statistic that I read on my way here was that since 1990, Bangladesh has more than halved its maternal mortality. So more than a 61% reduction, which is phenomenal for such, for Bangladesh to achieve that. But there are still some ongoing issues, especially in rural areas. It's often facilities aren't there, and there are a shortage of health workers and nurses. And a key problem there is that women are then giving birth at home, often without a skilled medical attendant to see to them. So when there are complications, they also can't get to the facilities. So I think it's around 9 out of 10 births in Bangladesh are still taking place at home. So that's something that the government has been very keen to address. And they've recently committed to increasing that proportion to about 50% taking place in facilities, in clinics. So they're stepping up their action in that area. And they're also taking massive steps to increase the number of midwives. So recently announced 3,000 places for new midwives in training facilities. So I think the problem has been recognised. They're making really good progress, and there is a lot of action on the ground. There are still issues in Bangladesh, as in a lot of other countries, with younger mothers and sort of teenage mothers and teenage mothers. And I think it's around 1 in 3 teenagers, women, girls, teenage girls in Bangladesh are already mothers, partly as a result of early marriages.
Yeah.
It is an issue, and I mean certainly, and this goes for women everywhere, young girls between the ages of 15 and 19 are 3 times more likely to die than a woman
3 times more likely.
3 times more likely in pregnancy and childbirth than a woman between 20 and 30.
So don't you think, Kerry, there is an opportunity for the doctors and the community leaders to advise and space the pregnancy or delay the pregnancy? Not to discourage them to get married at teenage. It's fine if the society and the religion sanctions that. But in terms of pregnancy, it's some role of the parental role of community leaders, academics and others.
Yeah.
And so there is clearly a need of campaigning and advocacy. Is Oxfam doing anything in that?
We're not doing anything specifically in Bangladesh at the moment. We do a lot of campaigning. Most of our campaigning work is around what we call user fees and direct payments in clinics. So we're not doing anything specifically on young mothers, but certainly sensible spacing is really important.
Absolutely.
And also linked to this is education and girls' education. And I know Bangladesh, one of the reasons behind this fantastic reduction in maternal mortality has been directly attributed to having much stronger sort of education for
I think the
girls.
World Health Organization and the government of Bangladesh, for all the successive government, did play a role in reduction of maternal mortality. But still there are key areas that we need to hit. And I feel that if this teenage pregnancy can be addressed, and because Bangladesh is a small country, of the women delivering at the local facilities, because Bangladesh, I have seen that the clinics have been established in the remote parts as well.
Yeah.
So that would reduce further. And organizations like Muslim Charities and others, if they were to establish more maternal clinics, a smaller clinic at 2-3 delivery centers, I think that would significantly reduce Bangladesh.
Yeah, I mean certainly having clinics closer together so people aren't travelling so far, and often the midwives or the nurses there play a very, or in community health workers as well, play a very important role in terms of delivering information out to girls and women, and trying to help with sort of health education as well. It's a really key issue.
So Waqas, can you say why some families insist on that the girls and the women to deliver at home? I mean, and how to deal with it?
Yeah, there are unfortunately there are many barriers, even when it comes to in the countries that we work in the developing countries. They stem from both religious and cultural misconceptions. As far as the religious misconceptions are concerned, it is often the case that it is perceived almost as if giving a birth outside of the privacy of the home is not allowed, is not permitted, and for that many people perhaps it is to do with the status in the society that the women hold. They simply wouldn't expose the women to the outside environment in that vulnerable position. However, they don't realize that in the hospitals there are complete arrangements, in the clinics there are complete arrangements to protect that very same privacy and the dignity of the women. It is not as if it is exposed any further. The only thing that's added to it is the safety and security of qualified personnel. And that's as far as the some of the religious barriers are concerned. Another thing is there seems to be almost a backlash quite often against the discipline of medicine, because many people still don't necessarily want to go out of the way and say that medicine is or the discipline of medicine is a solution. So there is an idea behind that as well, but it's certainly not the case. We have been encouraged to look after our health, and we've also been encouraged to seek the support of professionals. There is nothing wrong in taking the subject outside. The woman's dignity, the privacy of the family is still protected in hospitals, and people are out there to make sure that the treatments are given by medically qualified people. One barrier that interestingly comes across is we've often heard that people often say that for generations we have had the deliveries and stuff done through a particular family, or midwives, untrained midwives of a particular family, and people want to carry on with that heritage of system, the inheritance of midwives. But again, it comes down to the fact that there's no confidence there, because facilities don't have an outreach program. As such, people don't have the confidence in these facilities.
Yeah, but I think there are two issues. One is that promotion of education, and secondly the role of the religious leaders to explain to the
Absolutely.
others that it is fine to go and take help. But at the end of the day, is it not the responsibility of the government to tackle maternal mortality? I mean, and what should be the role of organizations like Oxfam and Muslim Charity?
I mean, I think you're absolutely correct, and ultimately it is the role of the government, and I think others can help, like religious leaders and charities like Muslim Charity and Oxfam. But I think ultimately the action that's needed to improve maternal mortality is ensuring that there are enough clinics, ensuring there are enough health workers, and ensuring that there are medicines and medical equipment. It's a sort of the building blocks of the health system, and ultimately it has to be the government that plays that role. And what Oxfam, we really strongly advocate for is to have every woman, every child, every man should have access to free healthcare delivered by the government that's good quality and that they can get to, and that's a really, really critical thing. It is ultimately the responsibility of government, and I think that where it's responsibility of governments in developing countries, but also governments in richer countries to actually support those initiatives, because often we've seen the progress in Bangladesh and the effort there on government and the impact that can have, but in countries where there are there is not enough resource to actually support that, it's important for governments in richer countries to also see it as their responsibility to address maternal mortality.
Yeah, I mean, something that campaigning that you have done in Sierra Leone, Oxfam has done is tremendous work. Now the government is sort of made it free delivery for all women in any parts of. Can you tell us anything about that?
Yeah, one of the key problems in Sierra Leone, as in many countries, especially in sub-Saharan Africa, is that women previously had to pay for deliveries in clinics. So often very, very high fees. So in another country, in Burkina Faso, the cost before they reduced fees of one normal delivery was 50% of a poor family's annual income.
My God.
So half of their annual household income would be for one delivery. That's not a cesarean section, anything complicated, it's a normal delivery.
My God.
Sierra Leone, across all of, wherever there are fees, it can be a significant barrier. So the government in Sierra Leone, very poor country, just coming out of a civil war, said we don't want our women to be dying unnecessarily for having to pay at the point of use. But the problem was they didn't have the money to fund, all the construction that was needed and the health workers to be trained. So what happened is Oxfam and many other organisations in the UK put pressure on the UK government to say, look, Sierra Leone really wants to remove user fees. They want to make healthcare free for all women and children under 5. And we did a lot of work with Gordon Brown, who's the then Prime Minister, and other MPs, and successfully. I mean, that was just UK public writing petitions, writing letters to their MPs and putting pressure, campaigning, lobbying. And the UK government did that, have been funding the free healthcare in Sierra Leone, and that came in 2010. And it's really had a massive impact. In the first year, 50% more women were delivering in facilities
Fantastic.
instead of at home. And even there was lots of talk about cultural preferences and things like that for home deliveries. But even there, when you removed the fees, women went.
I think it is such an important topic that you addressed. I mean, I think I need to translate it in Bengali.
Yes.
Because very important issue. Darshak, in countries like Burkina Faso, Sierra Leone, and those in sub-Saharan Africa, delivery at a clinic or in hospital would cost. I mean, সেখানে মানে কোন ডেলিভারি দিতে গেলে একটা মহিলার সারা বছরের যে ইনকাম, একটা হাউসহোল্ড, একটা বাড়ির যিনি কর্তা, যিনি তার আয় উপার্জনের অর্ধেক 50% খরচ হয়ে যেত একটা নর্মাল ডেলিভারি, সিজারিয়ান না, কাটাছেঁড়া না, জাস্ট নর্মাল ডেলিভারিতে সারা বছরের ইনকামের হাফ চলে যেত। অক্সফামের মতো অর্গানাইজেশনরা অ্যাডভোকেসি ক্যাম্পেইনিং করে, যে ইউকে গভর্নমেন্ট মধ্যে প্রেশার সৃষ্টি করে যে তোমরা সাহায্য করো, হেল্প করো সিয়েরা লিওনের মতো কান্ট্রি যারা চাচ্ছে যারা যে ফ্রি ডেলিভারি দেওয়ার ব্যবস্থা করতে সমস্ত দেশের সমস্ত মহিলা পপুলেশনকে, যাদেরই বাচ্চা হবে তারা হসপিটালে ফ্রি সুযোগ পাবে। এবং at the end of the day they managed to get the support and eventually Sierra Leone government এখন ফ্রি মেডিকেল কেয়ার দিচ্ছে এবং ফ্রি ডেলিভারি এনশিওর করছে থ্রু আউট দ্য কান্ট্রি। এবং প্রথম বছর 50% মহিলারা ও সেখানে যাচ্ছে। আচ্ছা, কোনো কল আছে? আই ক্যান টেক এ কল নাও। ইয়েস, হ্যালো, দেয়ার ইজ এ কলার। হ্যালো,
জি, আসসালামু আলাইকুম।
ওয়ালাইকুম আসসালাম। জি, কে বলছেন?
I'm listening to your program or watching your program, which is quite interesting.
Thank you.
And I'd like to thank your guest taking part in your program. It is certainly a very interesting topic, although there has been progress, no doubt, but there is considerable distance to cover, and I think although it's not totally possible to eradicate mortality, but progress, certainly progress can be made. And one of the reasons why there has been some progress is because there is an underlying policy by the government to improve the health, in particularly in the rural area and amongst the underprivileged. But because of poor governance and because of perhaps lack of resources, I can only speculate, the message is not getting across, and there is certainly room for more communications and awareness. And I think that is one of the key issues, is improving the awareness amongst underprivileged people.
Thank you. Thank you. Your point, a very succinct point, and that's why we have initiated the process of development dialogue. We can bring all those issues, inshallah, into the forefront. আমরা এখন ছোট্ট একটা বিরতি নিচ্ছি, বিরতির পর আবার দেখা হবে ইনশাআল্লাহ। আপনারা আমাদের সাথে থাকবেন।